Hi, salam sejahtera, and welcome to my poster presentation. First of all, let me thank you all for coming here today. Let me start. My name is Dimna David. I am from Sabah but currently working at Hospital Labuan. I am student of Bachelor of Biomedical Science, University Selangor, and today I would like to present my poster entitled Prevalence of Red Blood Cell Antibody Among Patients in the Federal Territory of Labuan. This is my poster, and I will start with the introductory part. Red blood cell antibodies play a crucial role in the development of immune-mediated hemolytic transfusion reaction and autoimmune hemolytic anemia. Blood typing and antibody screening form the foundation of ensuring the safety of transfused blood for recipient. Red blood cell alloimmunization is a significant undesirable occurrence during pre-transfusion testing. It can pose a major problem in case of long-term transfusion and create challenges in blood cross-matching. The general objective of this study is to determine the prevalence of red blood cell alloantibodies among patients in Labuan Hospital. Understanding RBC antibodies frequency and specificity in a community help choose blood unit and manage transfusion issue. Multiply transfused thalassemia, sickle cell disease, hematological problem, and solid tumor patient exhibit different RBC antibody profile and alloantibody frequencies. RBC antibodies in Labuan Federal Territory general patient population have not been examined yet. The variant of Labuan population can be used to study genetic variability and antibody specificity effect on RBC alloimmunization. However, no study have been evaluate the occurrence of profile of RBC antibodies in patients in this area. Next is objective. The general objective is to investigate the prevalence of red blood cell alloantibodies among patients in Labuan Hospital. There are three specific objectives. First, to determine demographic characteristic of alloimmunized patients. Second, to determine the specificity of RBC alloantibodies. Third, to identify clinically significant RBC alloantibodies. Next is methodology. These 2 years cross-sectional retrospective studies was conducted at the Department of Pathology and Transfusion Medicine Hospital Labuan, spanning from 1st June 2020 to 30 June 2022, with a total of 4,626 samples. A total of 65 patients were included in the analysis as positive antibody cases. This antibody screening test was performed using a commercial cell panel by microcolumn gel agglutination method from Diamate ID microtyping system. Data collection form was used to collect general patient demographic data consisting of age, gender, date of antibody screening performed, history of transfusion, history of pregnancy, discipline, diagnosis, and antibody specificity were retrieved from the laboratory information system. The result Table 4.1 shows that the total of 65 patients were included in the analysis, with 50 female, which is 77.4%, and 15 male, which is 22.6%. The majority of patients were adult age, especially between the age of 31st and 60. The database results show the presence of 11 distinct ethnic populations in the Labuan Federal Territory. Among these, the majority are Malay, accounting for 30.7% of the population. Chinese population is the second largest ethnic group, accounting for 16.9% of the total. Other prominent ethnic groups include the Brunei Kedayan at 13.8%, the Bajau at 12.3%, and the Dusun at 10.8%. The Kadazan community makes for 4.6% of the population, while the ethnic minority known as Bukan Negara Malaysia citizen also account for 4.6%. Murut, Suluk Lundaya, and Iban are the minority ethnic population, accounting for 1.5% of the overall population. Finally, as shown in the table 4.2, the Indian population account for 0%. Next, figure 4.3 chart of prevalence of diagnosed disease among the patient at Labuan Hospital. From the total of 65 patients, about 17 patients have been identified as having anemia, with 11 individual LPOL or latent phase of labor is the second most common disease. 4 for each patient also had prenatal problem, UGIB or thalassemia, 3 other significant diagnoses. 3 patients have been diagnosed with SLE and CKD, while 2 patients have been diagnosed with IDA and end-stage renal failure ESRF due to the problem following COVID-19. There is only 1 patient with each of the remaining diagnoses: tuberculosis, cardiovascular disease, myocardial infarction, HPA, diabetes mellitus, endometriosis, cirrhosis, cancer, cytopenia, appendicitis, Rh negative antenatal complication, and acute lymphoblastic leukemia ALL. Next, table 4.4 percentage of RBC antibodies specific among the patient. The most commonly found antibody is anti-MIA, detected in 35.4%. The second most prevalent antibody is anti-E, observed in 23.1% of the cases. Additionally, anti-LIA is present in 10.8% of the patient, while inconclusive antibody identification result due to the pan-agglutination present in 9.2%, while anti-M and no specificity antibody because of no patency and the antigram each present 6.2%. Anti-C account for 3.0% of the patient, while antibodies including anti-JKA, anti-JKB, anti-C, and anti-D each represent 1.5% of the patient. Next is table 4.5, display the transfusion history of the patient, categorized by gender. 11 of the total of 65 male patients, which is 70%, have a previous transfusion history. In contrast, 14 patients, which is 22% among female patients, have received transfusion. While table 4.6 provides information regarding the history of transfusion in expectant women. 13 account for 31.7% of the 41 expectant women who participate in the study have a documented history of receiving transfusion during their pregnancy. Next, discussion part. The finding contribute to the existing body of the information on the topic and assist in directing future research and the planning healthcare to address the special requirements posed by patients living in this environment. The finding of this study provide valuable new information regarding the ethnic makeup of the Labuan Federal Area. Labuan District ethnic makeup is illustrative of Malaysia's multi-ethnic culture. It is essential to have an understanding of the distribution of many ethnic groups in the country in order to successfully maintain social cohesion, address cultural concern, and put into effect effective policy and initiative. Next, conclusion. In conclusion, understanding the incidence of different RBC antibodies in the general patient population will benefit in the treatment of individuals with alloimmunization, autoimmunity, and multiple transfusion. Specificity and clinical relevance of RBC alloantibodies could prevent immunization complication, supply antigen-free blood after screening and identifying antibodies, and improve the blood supply management. Next, acknowledgement. I would like to express my gratitude to my supervisor, Dr. Muhammad Nazif, for his guidance and knowledge throughout this project. I am also grateful for the staff at Hospital Labuan, especially Mr. Muhammad Faisal, for the contribution to the success of this my final project. Additionally, I extend my appreciation to my friend from University Selangor. Lastly, I would like to acknowledge and thank all the kind individuals, especially my family, who have been part of this research journey. Thank you.